Hi everybody, it's the show here again with Birthday Hoover. Here at Birthday Hoover, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you like the content and you love what you hear, please be sure to subscribe to the channel. Today's topic is going to be about vaginal discharge and how we can identify just different problems or possible issues that we may be having based on the color and maybe the smell of your discharge. So I'm just going to get right into the video. The first, obviously, common color of a discharge is going to be clear. If your discharge is clear and it is odorless and egg white like or stretchy, it's usually a sign of a healthy body. It can come from sexual arousal, it can come from pregnancy, it can come from ovulation. You may be starting ovulation soon. It's a number of things that can cause you to discharge. And if it's clear and odorless, it is usually healthy and harmless. Now, if you are overproducing a clear discharge, and this is not spoken about enough, if you're constantly wet, your vagina is constantly wet, and you have to wear a panty liner all the time, and you can't seem to ever be dry, that is usually a sign that your body is overproducing discharge based on mucus, overproduction of mucus in your body. So that's just something to keep in mind. But if that's the case, it's usually going to be a little bit more on the milky side. Started to change a little bit color, in color, and you'll have a little bit of smell with it. So, but again, if it's clear and an odorless, it's pretty much a healthy, sign. A sign that you're healthy. The next color is usually like a milky white. I'm just gonna go down the line of colors. So milky white, thick. You're looking at a yeast infection, overproduction of Candida, and a poor gut health. So basically, you might need a probiotic. You may need to remove a lot of the yeast that might be in your diet, and increase your water intake. Address the fact that you have a yeast infection. Incorporate some tart cherries. I know a lot of people say cranberry juice, but I'm not really too fond of cranberry juice because of the pH level. But you can use other, dark berries, and things like that to kind of clear that up. And there's also some homeopathic, remedies and things that you can look up and look into. But mine is pretty much a more holistic, natural approach, and that's just kind of like phasing out yeast that's in the diet and increasing the water, and incorporating some tart foods, some tart berries juice into the diet. The next color is going to be like a gray, so like grayish, tacky in texture. It's going to be pretty much, that's mostly associated with bacterial vaginosis. That's a pretty common one that I see in my line of work of recurrent BV. I think that can come from a plethora of things like birth control, a poor pH balance, too many sexual partners, and not protecting ourselves. I think with the type of soaps that we're using on top of like lotions and things that we may be putting down there, and also the products that we use. I've done a previous video before talking about like the products and the things that goes on those products, which are a plethora of things: chlorine, pesticides, and all of those kind of things included. But we have to really make sure we are thinking about what we're topically using on our vulvas, because our skin is very absorbing down there, and we want to be careful of the things that we are using in our our flower places. So that's pretty much what that is. I know a lot of people have to constantly get treatment for bacterial vaginosis, and for me, I say you can try yoni steaming. You can try to clean up the diet, Be sure to stand clear of sex whenever you feel it coming on. You can use a raw unrefined coconut oil down there before and after sex to kind of, if that's when it's happening, if it's only happening during sex, or if it's happening after your period. I say address what kind of products you're using, and look at the things that you're washing with and things like that. The next color is yellow. So yellow is usually associated with STDs, STIs, and infections. This is not 100% the case, because sometimes our diet could just be so poor and we could be dehydrated, and our discharge can come out with a yellow tint. But if it's yellow, it has a bad smell, and you have itching and burning, then it's most likely some sort of STD, and you definitely want to go get that checked out and get that addressed and treated, as soon as possible, because they can lead to more critical, issues. So green is another vaginal discharge, and I don't often hear people tell me that their discharge is green, but it is a thing, and I think that is also associated with STDs, some kind of sexually transmitted infection, and that's pretty much is going to be need to be treated. So, I want to go back to the yellow one real quick, because I didn't mention like urinary tract infections, because that can be a cause of a yellow discharge as well. When we are starting to see green, I think that is just a more critical situation that I think needs to be immediately addressed, because that's something that has been there for a while, in my opinion. I can't say for sure, but in my opinion, I think that needs to definitely be looked at and checked out. So you have your typical brown reds. If your discharge is tinged with like a red color or brown, it's usually mean that you are collecting blood, and you're not, it's like clots, so you're not disposing or exposing the blood properly, and you probably need a womb cleanse. It's probably some reproductive issues there that you want to get checked out. And then there's your pink, which can be anywhere from, maybe you had rough sex, or maybe you are about to become pregnant, you have implantation bleeding, or breakthrough bleeding, if you are somebody who is on birth control but you haven't had a period for a while. Sometimes we get bleeding that just kind of says, you know what, I've been collecting here all this time, I need to just cleanse my body. And sometimes that happens. But those are pretty much the most common colors of vaginal discharge, and what they could mean. You definitely always need to consult with a professional. You definitely want to get medical attention if you're experiencing pain with any of these discharges, if you're experiencing a foul odor, itching, burning. And while I do believe in the healing power of your nutritional diet and herbs, that's for the people who I directly work with. But if you are someone who just don't know, then you definitely want to consult with a medical professional about what's going on with your body, at least so that you can know how to move forward in the care that you want to move forward in. But that's pretty much it. That's my information on vaginal discharge and what it can mean. And I will see you guys for the next video. If you have questions, if you have topics you want me to talk about that I haven't already spoke of, please contact us at birthyouhoover@gmail.com. And if you, oh yeah, I said that. So yeah, so I will see you guys for the next video. I appreciate you all for coming in and tuning in and subscribing and liking and sharing and leaving your comments. I'm so grateful. Peace and pregnancy, Des.